All right, today we are cracking a code. It's a secret language that doctors, surgeons, and scientists use every single day. And yeah, it sounds super complex, but I promise you're about to understand it. Let's dive right in. Have you ever been in a doctor's office and they're explaining something and you just find yourself nodding along, but you feel like you need a translator? Yeah, you're definitely not alone. You see, medicine, especially anatomy, has its own language for one really important reason: absolute precision. When you're talking about the human body, there is zero room for error. No misunderstandings allowed.
So, to crack this code, we have to start at the very beginning. We need to answer the big question. What exactly is anatomy, and why on earth does it need its own special language? Well, the word itself actually gives us a huge clue. Anatomy comes from the Greek for to cut up. It's literally the science of the body's structures. And when you're trying to describe something as incredibly intricate and complex as the human body, you need a language that is just as precise.
Okay, so you know how every map needs one of those little "you are here" markers, right? A fixed point to get your bearings? Well, in the secret language of anatomy, we have our own master key, a universal starting point. This is the one rule that stops everything from descending into total chaos.
And this is it. It's called the anatomical position. Think of it as our true north. It is the single universal point of reference for every single description we're about to learn. It seriously doesn't matter if a patient is sitting, lying down, or doing a handstand. When a doctor describes a location on the body, they are always imagining the body is in this exact position. So let's break it down, piece by piece. Picture this. You're standing up straight. Your head is up, and your eyes are looking straight forward. Your arms are just hanging at your sides. But, and this is the weird but really important part, your palms are facing forward. That automatically makes your thumbs point away from your body. Your legs are parallel, feet flat on the floor, also pointing straight ahead. That's it. That is the foundation. Every single term from this moment on assumes this pose. All right, so we've got our starting position. We know where here is. Now we need a map. And in anatomy, we create that map by slicing through the body with these imaginary flat surfaces. We call them planes. Let's see how they work. First up, we've got the sagittal plane. I want you to imagine a giant sheet of glass dropping vertically right down the middle of your body, dividing you into a left half and a right half. That's a sagittal plane. And if that slice is perfectly in the center, we give it a special name, the mid-sagittal plane. Next is the coronal plane, which is sometimes called the frontal plane. This one's also a vertical slice, but it comes from the side. Imagine that same sheet of glass now dividing your body into a front part and a back part. So you end up with an anterior half, that's the front, and a posterior half, which is the back. And last but not least, we have the transverse plane. This one's different because it's horizontal. Think of it like a magician sawing their assistant in half. It's a slice that cuts right across your body, dividing you into an upper or superior part and a lower or inferior part. Okay, so we have our starting point, the anatomical position. We have our map, the planes. Now all we need is a compass to actually give us directions. These are the directional terms, and the easiest way to remember them is that they always come in opposite pairs. Let's start with an easy one, front and back. In anatomy, anything toward the front of the body is called anterior. Anything toward the back is called posterior. So your nose is anterior to your ears. Your ears are posterior to your nose. Simple, right?
Next up, we have up and down. Superior means toward the head, or higher up. Inferior means toward the feet, or lower down. So using this language, we'd say your head is superior to your shoulders and your knees are inferior to your hips. It's all about where things are in relation to each other.
Now, let's go back to that center line we talked about, that perfect mid-sagittal plane. Anything that's closer to that midline is medial. Anything that's further away from it is lateral. So for example, your nose is medial to your eyes, but your arms are lateral to your chest. This last pair is a little special because we mostly use it for arms and legs. Proximal means closer to where the limb connects to the main trunk of your body. Distal means further away from that point of connection. So your elbow is proximal to your wrist, right? It's closer to your shoulder. But your fingers are distal to your wrist because they're further away. Okay, phew. We've learned the starting position, the map planes, and the compass directions. But you might be thinking, why go through all this trouble? Why does this matter so much? Why can't we just say front, back, up, and down? Well, there's a very good reason. This is where it all clicks into place.
Let's take a simple, clear statement like the ear is posterior to the eye. Because we have the anatomical position as our universal starting point, that sentence is 100% true and perfectly understood by anyone who knows the code. It doesn't matter if the person is upside down, lying on their side, that relationship between the ear and the eye never changes. It is an absolute truth.
And that right there is the whole point. This isn't just a bunch of fancy jargon to make doctors sound smart. It is a life-saving tool of precision. I mean, just imagine a surgeon's chart says, remove the lesion on the left side of the kidney. Okay, who's left? The patient's left or the surgeon's left as they're looking at the patient? See, it's confusing. But if that chart says, remove the lesion lateral to the kidney's midline, there is no confusion. None. This language removes all doubt. And in medicine, removing doubt can literally save a life.
So there you have it. You've just learned the fundamental grammar of anatomy. The code has officially been cracked. The next time you hear one of these terms, you're not going to be lost. You'll be in on the secret. So I'll leave you with this question. Now that you know the language, how will you see the amazing, complex map of the human body differently?